7 months post Restylane injections in tear troughs and visible lumpiness apparent, worst in left eye. Why? I never had lumpiness prior to injections for hollow under eyes. I experienced some unevenness in the left eye after injections, for about a month. Then it went away. Now it looks more uneven every day. I realize I need to get injections again, as I am at 7 months, but is this an issue with how the injections were done? My doctor is a board-certified facial plastic surgeon, but I'd like to address this and prevent this from happening next time.
Thank you for your question. You submitted a single photo, and you are 7 months out after having Restylane injections in the tear trough area. And you describe a situation where you had some lumpiness occurring after the procedure, and that resolved, and now you feel like you're becoming more and more aware of lumpiness in the under eye area, and you're concerned about having to go back for another injection at 7 months, because that's the timing that you were recommended to come back for, and you want to know how can you avoid lumpiness moving forward, and whether this was a technique issue and by your doctor. Well, I can certainly share with you some basic principles that apply to this particular area, and understanding that without a physical examination, but as well as not looking at any photos beforehand, I can just give you a general idea of some very important concepts that will probably be helpful for you when you see your doctor. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people with the under eye cheek area is a significant focus of my practice. Use of injectable fillers, as well as helping people with complications of injectable fillers, is a routine in my practice. So I would begin by just giving you my impression when I see your photo. When I look at the photo of the area that would be described as the tear trough, as well as an area just below the rim or the bone of the eye socket, the orbital rim, I see what appears to be relatively prominent areas of filler. Now, when we look at this photo, depending on whatever the lighting condition was at the time of the photo, it's almost like I can see what is referred to commonly as a Tyndall effect, or the bluish hue of filler when it is placed under the skin. Now, there's a variety of reasons for this, and one of the things that I would be concerned about, and I'd have you discuss with your doctor, is about the amount of swelling that that the hyaluronic acid filler creates as a function of the nature of the material. You see, when you place a hyaluronic acid filler like Restylane in any area, a certain amount of water gets absorbed, and depending, of course, on the level it's placed, that bluish hue and Tyndall effect can become relatively apparent. But it's not just the level. It also has to do with the tissue. When I look at your photo, my impression is that you have a very light skin, and your skin is relatively thin, and that you are relatively lean, so that there isn't much subcutaneous fat or cushion between the filler and the skin. And therefore, I think that this is an opportunity to actually discuss with your doctor different strategies where it could be possible to either reduce some of this material, because one thing that I would just mention as a variable is that when it comes to injectable fillers around the eyes, even though material like Restylane is well known to have, and specifically Restylane L, will have a longevity of about 6 months when it's placed around the lips. When the material is placed around the eyes, it can last considerably longer. We've had patients where it's actually lasted for years. And I think the generally accepted theory is, or hypothesis, is that the body forms a bit of a capsule around the material, and the material just doesn't get broken down as quickly. Now, that being said, the idea, of course, is when you're looking at the eye area to improve hollows, you want to restore up to a natural contour. And you also want to maintain a transition between the eye and the cheek that looks natural. So there may be an opportunity here to also think about volume correction of the cheek area. Many times when patients come to me and present with under eye hollows, when I take their pictures and I show them on the screen that they have not only under eye hollows, but they also have hollow cheeks, that the filler effectively, if it's placed only in the under eye hollow area, is kind of on a ledge, and it's kind of sitting all by itself, and it can make it look more obvious. When you place it artfully in a very smooth way with a transition between the cheek and the eyelid, well, the volume of the cheek and the transition to the under eye area is much more natural. So when I talk about cheek volume, I often discuss a concept called structural volumizing. In structural volumizing, we're placing the material like a Juvederm Ultra Plus or Juvederm Voluma, which I prefer because of the longevity of these materials. I place it into at the bone level on the cheekbone, as well as into the soft tissue in front of the cheekbone or in the under eye area, often referred to as the submalar area. You can actually get this very pleasing natural balance between the two areas. So I think that when you are seeing your doctor, of course, mention these concerns. And of course, what I do routinely in my practice when I see my patients is I always look at their before pictures. I look at how they look after I've done a procedure such as this. And we always study opportunities to improve and maximize outcomes so that we can get the best results that makes the whole face look better. And so I think that these principles, the longevity of the filler, the placement of the fillers, and the possible additional benefits of fillers in other areas is very important for you to discuss. Not to mention that if an area does look overcorrected, that that material can be dissolved using an enzyme called hyaluronidase. And so sometimes when patients come to me who have had filler done elsewhere, they'll come to me, and if they look like they're overcorrected or that just doesn't look right to me, I'll start by saying, let's just dissolve what you have and start fresh. Or sometimes we try to dissolve a little bit and see what happens. It just depends on the individual case. So I hope that was helpful. I wish you the best of luck. Thank you for your question.